Good morning. It's a very short video on the liver function resources on DXS. So if you haven't got this floating toolbar, just go down to the bottom here, click DXS and it will appear. In this case, I'm going to keep it fairly general. I'm just going to type in the word liver, hit return and see what comes up. The reason that's useful is that you can see there are at least 5 or 6 different care pathways relevant to the liver. Probably the one that we come across most often is the raised ALT and its relation to non-alcoholic fatty liver disease, or fatty liver as we know it, or the more serious NASH. There's also some East liver pathway notes. There's something on gamma GT, raised alkaline phosphatase, ALP, and it's also part of the wider East gastroenterology care pathway. So let's just have a quick look at this one. To begin with, this is the ALT pathway, and it's actually fairly straightforward. If the ALT is less than 100, review in 1 to 3 months. It's normalized, no further action. If it is raised more than 2.5, the upper limit of normal, so in other words about 100, and it's raised at that sort of level for greater than 3 months, or indeed if at the outset it's between 100 and 400 and you've reviewed after a month and it's still raised, you go on to do an ultrasound and a liver screen. Now the liver screen is a sophisticated set of blood tests, so if we click there, what that'll do is just take us to the bottom of this page and it shows you what those tests are. Hep B surface antigen, Hep C, liver autoantibodies, immunoglobulins, iron profile, alpha-1 antitrypsin, ceruloplasmin if they're under 45 for the very rare Wilson's disease, fasting lipid profile, random glucose, aspartate transaminase, which is an AST, and a gamma GT. As you can see, based on these results, including the AST-ALT ratio, it may show you what sort of guidance is recommended. But let's just go back up to the rest of this pathway and say that if you do those blood tests and the positive screen, then you might treat if there's a specific diagnosis which shows up, or you might refer to gastroenterology. If you click here, it'll take you to the what used to be known as ALL, advice letter listing, or probably more commonly now PRG, pre-referral guidance, and it'll tell you how to make the referrals. A FibroScan needs to be ordered via the same form. So basically, it's you can order an ultrasound, but you can't order a FibroScan. That is done by the gastroenterology department. So I'm just going to come back using this arrow up here to the care pathway. If your ALT is greater than 400, then you're meant to do additional bloods in addition to the liver screen which you just looked at. In other words, hepatitis A, hepatitis E, CMV, Epstein-Barr virus, and to look for glandular fever, and again make the referral. So really, less than 100 ALT, 100 to 400, and greater than 400 are all dealt with in different ways. So that's that particular pathway. Now if I hit this arrow at the top again, it'll take me to the other care pathways. If we look at this one, the raised gamma GT pathway, it's much shorter, it's much more straightforward. More than 3 times or less than 3 times the upper limit of normal determines what you do. Just going to go back here, and we've also got other care pathways which are relevant to it. So that's it. It was just to give you a quick flavour. The reason some of these, or I should say the reason this list of care pathways is now shorter than it was, is that anything I've recently accessed or view recently accessed goes up to the top here under favourite and recently accessed items. You can also favourite them, which will make it easy to find again in the future if it's a pathway you use very often. Thanks for listening.